Okay.
Thank you very much for coming. Okay, wow, that's a lot of people, huh? Okay.
Hello. I'm not used to this many cameras here, so it must be the people around me that are attractive. Mr. Commissioner, Dr. Kovachev, MEPs, friends, I'm Anders Olausson, and I'm the President of European Patient Forum, and I'm extremely happy to welcome you all to this day, to this inauguration, or to give birth to the interest group of patient access and healthcare. And we're going to hear, everyone has got a program, I hope, so you can follow this. I'm also a little sorry for we are a little late, so we're going to push for it and leave the floor and the time to the people that are most interested to listen to, and that is not me. I just would like to say that access is really the core front and the fundamental for patients and for European Patient Forum. Access to healthcare, access to drugs, to treatment, and to knowledge and to information is a cornerstone. Without that, we don't have a Europe that is worth with a healthy Europe. So this is why we are so extremely happy for today, that having this meeting today, and also having all of you here. I'm also very happy that we have working on the Vilnius. This is some kind of continuation of the Vilnius Declaration that we sought to unify the stakeholder and bring about the involved in the driving action on these issues. So I'm very happy for that. And of course, I am extremely happy for having the Commissioner here, but I will give you some nice word later. So let's first talk and listen to Dr. Kovachev, MEP, who is really our friend in this. Thank you.
Thank you very much, Anders, and welcome to everybody here. Commissioner, welcome, and thank you very much for following our invitation. Dear colleagues from different political groups, different countries who are supporting the platform, dear guests, I'm honored that I see this room which we reserved is small actually, and we have so many people interested to the topic, because indeed Europe, it's difficult to explain to European patients and citizens why European Union is taking more care maybe on agriculture and animal welfare, but not on human health. We talk about growth and jobs for European citizens. This is what we are doing here in this House for the last few years. But none of these goals can be achieved without the European citizens. On one hand, we say healthcare is a priority for Europe, but from the other side, the healthcare responsibility is fully in the hand of the member states. What we can achieve more as an added value of Europe to provide to the member states more tools and possibility for equal quality according to the 21st century health service to our citizens. Member states account for different models of healthcare management. Some national healthcare systems are underperforming in terms of public spending efficiency, but also in terms of quality and access to medical services. This is the case, for example, in my home country, Bulgaria. This is also cases in many of the new member states. Inequality in healthcare services provoke migration of patients towards member states where medical treatment is better and easier to access, even in some cases life-saving. The same holds true for healthcare professionals, doctors and nurses who are looking for better conditions to have a better career development in member states with more competitive healthcare system. This makes the problem of access not only a problem of the new member states, but for the all member states. This is a problem which we recognize here as a problem for all member states of the unequal access to quality healthcare. As a result, human health needs are not equally addressed across the European Union, with tangible consequences for the performance of the European workforce. Poor healthcare quality in one member state provoke burden for the budget and social security system of the rest of the European Union. The European Union growth and jobs objectives is undermined. Patients are paying the cost of non-Europe. This sentence we repeat many times on many occasions, not only in the health field, but in many fields, that the answer is more Europe. But now it's to us, to the stakeholders, to the patients, to the doctors, to the nurses, to the industry, to give the answer. What exactly is the answer in the healthcare field? I see the platform already as a fact existing, and the group in the European Parliament, and together with the Commission, as a good possibility to identify this priority, this added value of Europe in the healthcare area, which we can serve with which we can serve our European citizens, and European citizens, unfortunately, in the life of everybody, in some point of time, everybody is a patient as well. So to serve the European patients with adequate to the 21st century health quality service. I will stop here, and I'm very pleased to hear the debate also with my colleagues later on, but first of all from the Commission, how the Commission see this platform, and what we can do together, Parliament, the platform as a stakeholder organization, and the Commission to serve our European patients. Thank you very much.
Thank you, Dr. Kovacev. It's very nice to hear your words and also the statement and the analysis. Mr. Commissioner, since you made it difficult for yourself, because you have stated when you started as Commissioner that you're going to work hard for improving the healthcare of all EU citizens. So access is really a cornerstone in that. So please, we are looking forward to hearing you.
Of course. Honourable members, ladies and gentlemen, Mr. Chairman, yes, you are right. I fully agree with you that access is cornerstone. I'm very pleased to be here to join you for the inaugural meeting of this interest group on access to healthcare. I'm very happy about it. Personally speaking, I'm so happy today. Can you imagine? I fully support the European Parliament commitment to raise awareness on this issue. Thank you for giving me the opportunity to add my voice to this important initiative. As the EU Health Commissioner, I have an overview of the health performance of each and every EU member state. I know that problems of access are found everywhere in the EU, but their intensity varies within and across member states. In many countries, voters have already sent a clear message. It was not so, it was a few days ago. They would not put up with policies that not only neglect citizens' rights to access health care, but eventually pushes them below poverty line. Maybe I am wrong. Let me mention some numbers to illustrate disparities among European Union member states. Please, I would like to show you first slide. If you look at the slide portraying life expectancy in the EU, you will see social determinants in health. You see green color and yellow color, and you see two different pictures. And my job is make European Union more greener. Can you imagine possibilities to make European Union more greener in my term of office, only 5 years? I have I have 4 years and 9 months, because I lost 3 months. No problem. Can you imagine make European Union more greener without you? No, it's impossible. Slide 1. On average across the European Union, health spending decreased by 0.6 between 2009 and 2012. In some countries, especially in those which suffered from economic crisis, it has fallen drastically. Slide second, okay. Unmet needs for medical examination are reported by more than 12% of the population in the lowest performing EU member states. It's evidence. Slide 3, please. Life expectancy between EU member states has a gap of 12 years for men and 8 years for women in the highest and lowest performing countries. Next. Infant mortality rates, dramatically, yes, differ sixfold among European Union member states. My job is to investigate how we can close these gaps between member states. Barriers to access to health care can be multiplied, of course. Financial, administrative, geographical, legal, and cultural. Barriers may affect particular population group or simply result from an insufficient or inadequate distribution of resources in the system. For this reason, health policy is a broad responsibility. It is not just for health ministers or health specialists. It is for all parts of government and for all policymakers. Therefore, I stand for a health in all policies approach. And let me give an example. When access is limited for a particular population, for example, populations in rural areas that don't have access to adequate services, the solution might lie with other policies such as transport. We must raise questions about transport, how to deal with transport, to raise questions when we speak about accessibility. For this reason, I want to ensure that health is an integral part of all relevant policies, including environment, social, and economic affairs. You may know that my priorities are simple: prevention, promotion, protection. Thanks to my young followers on social media, I would also like to add an additional P: participation. Participation in the other 3 Ps. And this is an example about participation. We need to play our part to the full, be it in Brussels or in the European capitals. Therefore, I want to highlight the importance of partnerships with all the relevant stakeholders. They are essential to gain insights on the ground and help with identification of barriers. The initiative launched by the European Patient Forum is a good example of such mutual beneficial partnerships. My services have been involved in the discussions with members of European Parliament, professionals and patients' associations, industry representatives, and other stakeholders. Some members of European Parliament, such as our host, Mr. Kovachev, have been particularly active in those discussions. It goes without saying that I fully support the goals of this interest group. For this reason, I hope that my priorities will be able to benefit from the political support of this House and through this interest group in particular. There are a number of actions that could complement the goals of your interest group. Let me give you some examples. The communication on effective, accessible and resilient health systems, published in April 2014, which defines 3 pillars for a health system, and one of which is access. The implementation of the Directive on Patients' Rights in Cross-Border Healthcare, which will serve the increased transparency for patients on national health systems. The development of the European reference networks, which will be a priority in 2015. It's my job today in 2015. The expert group on health system performance assessments, which will help us to guide and support the enhancement of health systems to improve patients' outcomes. Of course, the European semester can increase the prominence of health and access to health care in the recommendations made to member states. My services DG Sante will coordinate closely to support and complement policies in the fields of social inclusion and social protection led by DG Employment through the open method of coordination. We are ready to do it. DG Sante will also continue the joint action on chronic diseases, helping to facilitate the exchange of good practices in tackling chronic diseases and promote healthy aging. My idea is to have all 28 countries, member states profile, speaking about chronic diseases, and see which instruments are more powerful in which countries, and to support those countries to act in proper way in seeing our map, to make our map more green. We have now started our third health program, 2014-2020, which is a key instrument for investing in health and promoting growth in Europe. Plus, we are supporting member states in their commitment to address inequalities in access. We can work together on innovations that benefits patients and in driving solutions to patient safety, including the prevention and control of healthcare-associated infections. Finally, the Commission is supporting action on patient empowerment. A fundamental tool to improve efficiency of health systems, reinforcing healthcare quality and improving patients' outcomes. The empowering patients in the management of chronic diseases is called NICE Empathy initiative, aims to deliver research to inform the development of EU policies in this area. Honorable members, ladies and gentlemen, but it's mostly friends or like-minded. I see people which are like-minded. More than ever, we must not forget that access to health care acts as an effective safeguard against poverty. My job is to identify key obstacles in access to health care for patients and facilitate dialogue between European and national health stakeholders, to assess gaps in access to quality health care within EU member states, to address these gaps through collaboration, and to help in finding substantial solutions. Let me finish by thanking all the honorable members involved in the creation of this interest group. I look forward to our future fruitful cooperation. I am confident that our actions can and will make an important contribution towards improving access to health care across the European Union and changing European Union color. In 5 years, our obligations a little bit changed such color and more green color. Thanks a lot.
Thank you, Mr. Commissioner. Thank you. I like to be greener. I don't know what the environmental people think, but I think we will hijack that, make Europe greener. So I think that gives us a picture of what we wanted. This is, I'm really excited here. I'm really looking forward the next 4 years to where we're heading and where we're going.
In 9 months.
9 months.
9 months?
4 years.
Yeah. But we. Okay. 4 years and 9 months. You open so many doors with what you're saying. So be ready. We are coming. All of us here, all the stakeholders in the room. Okay. Thank you. And now we're going to hear a virtual version of the Bulgarian Minister of Health, Mr. Moscow. Or do you say Moscow or Moscow? No, Moscow.
Moscow.
Moscow. You don't say Moscow, no. No, Moscow. Sorry for that. Who's going to be virtuale?
I have the honor, and I'm happy that we have at least from 28 now, 1 member state who already expressed the support to the partnership, and I'm sure that also the Minister of Health of many of the member states will follow the Bulgarian Health Minister, Mr. Peter Moskov. He sent us just this morning address supporting the initiative. He was so officially invited to be here, but unfortunately, due to his political work in Bulgaria, cannot be with us. And he expressed his support to the Access Partnership, will engage with stakeholders and involve them in the semester process, which is a very good, as the Commissioner also mentioned, instrument for identifying the gaps and recommend to the Member States the necessary reforms in the health system. Minister Moskov also is ready to call to other Member States to be on the same level and support the partnership in the Council, because without the Member States, as you can imagine, we cannot do it. We are here at the European level. We go for, some of us are more federalistic approach and would like to see Europe more united and more federal, but the reality is that we need, especially in such a field like the healthcare, the member states. So I'm very happy that many colleagues, even if they cannot be today with us, express their support in the European Parliament for the platform and for the initiative, and I will call to them also to contact their ministers of health and governments, make them knowing about the platform and asking as well for their support. Thank you very much.
Thank you. Okay. We have a short intervention. Listen to Stan. Is that possible? It has taken 7 minutes. Yeah. He will listen to you.
Oh, okay.
I promised the Commissioner you will speak in 7 minutes, which is a challenge itself. This is all good initiative. I just want to say that. All good initiative always comes from the heart. And this initiative with the access wouldn't be able to be where we are today if it wasn't for Stan and his work with his colleagues in Bulgaria. Really from the heart. So please, Stan.
Thank you. Thank you, dear Mr. Commissioner, for staying for this speech. Dear Dr. Kovachev, honorable members of the Parliament, dear guests and friends here in this room, it's really an honor for me to come to this stage after few years of efforts of bringing the different stakeholders in the same room and to be on the same track and talking about access, willing together to address the access issues. But let me remind you why we are all here at the end. As chairperson of National Patients Organization in my country, which represents more than 80 patient groups, every day I meet with patients coming from different disease areas. Patients who are fighters, patients who are really good fighters and doing really well, even sometimes they're in a very difficult situation. I also have the opportunity to work with our government on a daily basis, trying to reform the healthcare system in the best possible way for the patients. And I know how challenging it might be for the member states as well to address all the issues that they might have. As board member of the European Patients Forum, I have the opportunity to know that the access issues are not only a problem for my country. Actually, they're a problem for other member states as well. And within the member states, there are some challenges in every single disease area. And now, as Secretary General of the Patient Access Partnership, I know that challenges are also for healthcare professionals, also for those who take care for the patients, also for the European institutions, also for the industry. And I know that the only way that we address these issues is to work together. I will give you 2 very small examples. Right now, we all know the revolution with hepatitis. We have real medical revolution, something that's coming that could change the game, and many patients would benefit of that. This innovation was driven also by European researchers, by people who invested lots of time and knowledge to develop this innovation. But at the same time, I know that for some patients, the innovation is not going to be accessible in the near future. Maybe some of those people are not going to be alive at the time when we can assure access. Let me give you another example. There are areas and regions in Europe where patients simply don't have access to healthcare professionals, to services, to nurses. And they suffer from diseases that are otherwise preventable, treatable, if they have the proper services around. So this is actually the fundamental rationale for the Access Partnership. It's easier to ignore the situation, it's easier to continue the business as it is, but it's not acceptable in nowadays Europe. That's why we have to see access as a basic human right and a problem for the solidarity between member states. Let me remind you how we got here. Very briefly, everything started more than 2 years ago with a small conference in Sofia focusing on the new EU member states and health inequalities, widely politically supported by our politicians in the parliament and also the local politicians. Then the strong political support from the EU Parliament and the Vilnius Declaration coming to the point when we have the European Access Partnership established end of last year, which is aiming to force and to develop, to drive and propose to the European Commission and the Member States sustainable solutions, solutions that will help the Commission and the Member States to improve access. And now, at the end, where we want to go. We want access to be high in the political agenda of the European Union and the Member States, and also for all stakeholders. We want to use all possibilities and political instruments to engage and support Member States to address access challenges, such as the European semester, and we already have some very good examples of engaging with the Commission and the Bulgarian government on this process, and hopefully it will lead to good results. We want to analyze hurdles, to identify gaps and barriers, so we are able to influence and support the Member States. We want to develop, drive, and propose solutions that work for patients and for the stakeholders. I'm really happy to hear all words today. I'm really happy that we have this huge support, political support, from the members of the Parliament coming from different countries. And we are really grateful and hope that their work will help all of us to drive towards better health in Europe and to assure better access for the citizens. At the end, I will simply say the Access Partnership and the interest group here on access are in its infancy. They need to be cared and they need also to be supported. Trust and commitment of everybody in this room. Equitable access is everyone's business, and this means more than words. It means hard thinking and hard work. Thank you.
Thank you for that. Thank you very much. And while I say goodbye to Mr. Commissioner here, I would like to open the door for Cristian Silviu Buschi. Sorry for that. I'm from Sweden. For the first Parliament speaker.
Yes. Can we go? The members.
We should go upstairs.
Yeah. Yeah. Maybe all the MEPs who are going to speak can come up and sit here now.
The co-chairs of the group.
I stay.
You stay.
So I can be the voice in between. I must say that this is fantastic to hear all this. Don't you feel the same? Hello. It is. It's a great day and it's a great initiative. So we have 6 MEPs who's going to say why they support this, and I was asked to say that also, what are you going to do in supporting this? I thought that was a little close to rude, but it's a strong thing. Anyhow, so let's begin.
Thank you so much. Thank you so much for inviting me, and I'd like to thank Mr. Kovacev very much for his invitation to be a part of this event and also to co-chair the interest group on patient access to healthcare. Unfortunately, I will not be able to stay the whole event because I have a special guest from Timișoara, my city, and at 1:30 the event will start there. But I insisted to be here because I really support this initiative, and I think it's an important initiative for the future of patients' access to health in European countries. Health inequalities usually result from the uneven distribution of social and environmental determinants, the different access to resources as education, employment, or health services, different levels of participation in society, and different levels of control over life. It is known, and we have to recognize this, that many countries in the European Union, such as Romania, my own country, Bulgaria, Greece, Portugal, Italy, continue to experience marked and deteriorating health inequalities, which disproportionately affect vulnerable and socially excluded groups. There is an evident difference between resource-limited member states, most of them from Central and East European, and the wealth ones, the old members of European Union. Although wealth in Europe has increased in the last decade, its distribution has proven to become increasingly unequal. There is still a high number of people living in poverty, including one child out of 5 being born and growing up in economic and social deprivation. Still, these numbers are likely to be even higher when accounting for parts of the population not existing in any official records. For this reason, it is important to ensure that new treatments will reach patients equally in every corner of the European Union. This needs to take place continuously, predictably, and within respect to the EU legislation. There is also an increasing necessity for coordinating actions across various policy areas, as well as the involvement of other non-governmental and political stakeholders. Last but not least, European health systems must ensure to deliver high quality and safe health care and public health services accessible to all, including equal access within and between member states to modern and cost-effective treatments. Thank you very much, and once again, many thanks and many congratulations for the initiative of Mr. Kovachev.
Dear guests and colleagues, I need to repair one mistake what I made at the beginning. I forgot to announce the co-chair of the interest group for access to healthcare, and I'm very honored that these colleagues accepted to be co-chair in this interest group. I think we have a lot to do in the next years to come, together with the partnership with all stakeholders, but now the name, Biljana Borzan from Croatia, Marian Harkin, I think she's not there today, but she accepted also the invitation, Christian Bușoi from Romania, Karin Kadenbach from Austria, welcome, Katarina Konečina from the Czech Republic, and myself. So we are 6 co-chair of the interest group. And many other colleagues who accepted to support the interest group, like Charles Tannock from UK, Alois Peterle, he was at the beginning there from Slovenia, Madame Salden-Mose from Denmark, Teresa Comodini-Caccia from Malta, Karol Karski, he was, I think, there but just left, from the ECR from Poland, and my dear colleague Vladimir Uruchev from Bulgaria. Also many others. I'm sure in our work we will have the support of many other colleagues from different member states and political groups. Thank you very much for your attention.
Thank you. Thank you. Thank you very much. Can we follow? We take the number from the top. Biljana Borza. And I'm very sorry for the pronouncement of the name.
Very well.
Okay. Thank you.
Thank you. I would like to thank, first of all, Mr. Kovacev for organizing this, and thank you for inviting me, of course. Well, dear colleagues, all of us all agree that, unfortunately, health issues are not so high on the agenda of European Parliament because of the subsidiarity system. But I think that we also agree that this is a very important issue, and there are a lot of problems that we can work on together in order to have a well-organized health systems in all member states. If we look at the Treaty of the European Union, it says, and let me quote, "The Union is founded on the values of respect for human dignity, freedom, democracy, equality," and so on. If we look at the facts regarding healthcare, there are a lot of differences, and we cannot talk about real equality for all EU citizens. As Mr. Commissioner mentioned, the difference in life expectancy, for example, between Latvia and Spain is almost 10 years. Also, there are a lot of differences in incidence of cancer, infectious diseases, and so on. These and other important issues are in great part caused by the difference in access to healthcare between member states. I'm aware that those differences depend on GDP of member states and that healthcare budgets vary from state to state. We must take note that financial crisis had a different impact on healthcare systems of different member states. Good example of how EU can improve a common health problem and act together is a tobacco directive. We all expect that this directive will lead to decreased smoking, especially among young people, and consequently decreased incidence of lung cancer and other smoking-related diseases. I think that same or similar action should be undertaken on alcohol abuse, because we know that Europe is the hardest drinking region in the world. Abuse of alcohol is higher in rich countries, but negative consequences of alcohol abuse are felt more in poorer countries. One of the reasons for this is unequal access to quality healthcare. To conclude, I would like to recall something that Commissioner Andriukaitis said during his hearing. He outlined his vision for a health union. I have to admit that this health union is music to my ears. This corresponds very well with the principle of equality that is enshrined in the Treaty of the EU. And this is one of the reasons, I think, that why we are here today. Thank you.
Thank you. Thank you very much. And we're moving on to, then it's a challenge again to pronouncing Katerina Konechina. Close to right?
Yes. Thank you.
Thank you.
Dear colleagues, dear guests, I'm glad that I can be present of this group. Health is a value itself and prerequisite for stability and economic growth. Investment in health and equal access to health services contributes to a healthy workforces and also to social cohesion and justice. I should be emphasized that the current policy of cuts and reduction leads to suppression of claims and patients' access to health service. I hope that with the help of this group we can stop this constantly deteriorating situation. Now I will be maybe more concrete and not so, and I hope that you will understand me why. I have been dealing with the issue of access to healthcare and the so-called patients' associations for a while now. However, I often encounter lack of knowledge and unprofessionalism within these organizations, which is a rather dismal from these very specialized associations aimed at protecting patients. Therefore, I have been supporting on a long-term basis a project called the Academy of Patient Associations that originated in my country, the Czech Republic, and whose aim is to cooperate with these associations to educate them so they can grow and improve their overall facilities, and through this promote better and more effectively the rights and interests of patients and their families. The aims of this project, which is currently trying to implement beyond the area of Czech Republic, are to promote the independence of patients' associations and other organizations, to allow their long-term development, to teach them how to effectively raise funds from various domestic and European sources, and to improve their presentation and negotiation skills. For this purpose, the Academy hosts a number of tutorials and meetings every year, where they transfer their knowledge to the patients' representatives with the help of many experienced lecturers and experts of fundraising, project management, and strategic management or communications. Currently, we are trying to expand this project to other member states, and therefore I would be very pleased if this project and the overall issue of patients' associations, their activities and their mutual cooperation could be one of the enterprises in this group's program. Ladies and gentlemen, thank you for your attention. I look forward to your cooperation, and I very thanks Mr. Kovacev that you give it so nice meeting today, and I hope that we will be continue with so nice meeting, and it will be maybe so not only about the world but really about the world as a whole for people in the whole Europe. Thank you very much for your interest.
Thank you very much. I close to promise you that it's going to be work, much work on this. And then we're moving on to Austria, Karin Kadenbach, or Karin Kadenbach.
Whatever you like. Yes. Hello, my name is Karin Kadenbach. I'm a member of the European Parliament from Austria and a former state health minister from Lower Austria, the region around Vienna. It's my second term now that I'm in Parliament, and I'm also vice president of the Health Forum Gastein, an international platform where we meet annually to discuss with stakeholders everything about health, health security, health care, and so yes, let me do a little bit promotion. You are invited to join us this October again. One of the main reasons why I'm very happy that this initiative now has its inauguration today, and that the room is so full of interested people and future partners, is that we have discovered that there is a big need for patient access to best medicine, to best pharmaceuticals, to best medical treatment. And I think what Commissioner Andriakis said before should come true. It's nice that I don't know if it's a coincidence, but on the invitation it's all dark green already, so I think that's quite one of the aims we have. Because it's nice to have words like health in all policies. It's nice to have a lot of big aims, but if we do have a public, and it's for me it's only the consumer, it's not always the patient. I think the patient is the second part of it. First of all, you are a consumer in a health system, because I want to have a health system that also has health prevention so that you don't become a patient. But you have to have the access to all of this, and that needs to empower the people in Europe, to empower the patients to get this access, and it's why one of the most important things for me for this initiative is also to have and focus on health literacy. We do have studies in Europe that show that more than half of the Europeans have real problems and define the problems for themselves, so that they don't know where to get information from, that they do not know what a healthy diet for them looks like, they do not know what rights they have. And the same is not only true for the European patients, it's also very often true for all the stakeholders in the health system and in the healthcare system. And one more point is that we are always talking about innovation in the pharma industry, or that's at least one of the points we were talking last days here. And I think it's very important that we do have a lot of very innovative pharmaceuticals, but what we need is the access of the patients to all these medicines and to all these treatments, because, I mean, it's nice to have it, but if you can't get it when you need it, it's not much help to you. So that's one of the things I think the European Parliament and all our stakeholders should really work on, so that it's not a question of reimbursement systems in the different member states. That's not the question of the healthcare or health insurance system you're in, if you get best medical treatment, if you have the access to it. So these are just two of the points for the action I want to take in the next years. That's health literacy and access to best medicines and best medical treatment for all Europeans, independent where they come from, who they are, what language they speak. Thank you.
It sounds like we are getting a whole Europe soon when it comes to health as well. So the ambition is very clear, and we have heard great words and great commitment among MEPs and the Parliament and elsewhere. So I would like to open the floor, unless there is anyone who wants to say anything more.
A few words. And as you say, Anders, that we need to work, I was thinking on some concrete initiative what our interest group can do in the next months or weeks. For sure, what I mentioned already, contact with our national stakeholders and state authorities to advocate for the access partnership model to be implemented on also national level in the 28 member states. As you heard before, in Bulgaria we have already the commitment of the minister that he is ready to cooperate with us. European semester, what we can do is to influence the process, the amendments in our own initiative reports in spring and in autumn, but also even more important to push the national member states to implement these recommendations. Invite national policy makers. I can announce that already we have the commitment of Minister George Freeman from the Minister of Health of the United Kingdom that next time when he's in Brussels, he's ready to meet our informal interest group, maybe even in February. Advocate for a budget line, as the Commissioner mentioned about the identifying the gaps, a measurement tool where in the Member States what can be done. And for sure we can do something on information to our colleagues and to the Member States. Why not to publish a brochure to communicate to national stakeholders the opportunities to have funds under the either operational programs or Horizon 2020 or health program. All this communication, but many times it's complained the European Union is too complicated, we don't understand where and what. When I visit hospitals in Bulgaria, this is the first thing what I say, hey, we don't know which program, horizontal or operational program we can apply, can you give us the advice? Why not also to be involved in this? But this is only few ideas, and I'm ready with my co-chairs, but also with everybody to discuss later what we can do, and following the process in the Parliament, in the ENVI committee, but also in other committees where the topic is coming to be active. Thank you very much from my side.
Thank you. Thank you. Okay, let's open the floor then to questions. Please say who you are and what you represent. Thank you.
Yes, thank you very much. I represent the Transatlantic Consumer Dialogue, which represents millions of consumers and also health activists in Europe and in the United States. We are very, very concerned that only a small minority of patients are getting access to the best treatment for a number of illnesses. Last week, we had many hepatitis C patients protesting outside the European Parliament. I come from Spain, that we have over 500,000 people affected, and only 5,000 people are getting the best treatment because the price is exorbitant. What I'm saying is, and this happens with many cancer drugs, most new cancer drugs that are coming out cost more than 10,000 euros per month for treatment. This is impossible for at least half of the European countries to treat most of their patients. Impossible. So we're not talking about necessarily always a win-win situation. We're talking about, on one side, we have some companies that are doing profiteering. On one side, massive, like for the hepatitis C pills, they're making over 1 billion euros a month just off this pill that is being sold for 80 euros in India, this 3-month treatment, and in most European countries between 25,000 and 55,000. The I&D cost, this is the mantra. We have no transparency about that. The industry itself admits that it spends less than 5% of its income on R&D, but we aren't choosing the failure. No other industry in the world do the patients pay the failure. And also the public return has to be taken into account on public investment. We invest, the vast majority of the whole long pipeline of research is done with our money, taxpayers' money, and that's not reflected in the prices either. So what I'm saying is, it's a European issue. A few years ago and today, the European Parliament set price caps on roaming calls, calling between one country and the other. Nevertheless, it's taboo, absolutely taboo, to think about price caps on cancer drugs or hepatitis C drugs, of which tens of thousands of Europeans are dying every year, lack of the best treatment. So what we're talking about is an issue that could affect public research, EU competences, transparency. We don't have transparency yet on clinical trials, on prices, et cetera, et cetera. We're also talking about public return and public investment. We're talking about putting strings attached to EU funding. Why is it?
What you're saying is extremely important.
Yeah.
Please, do you have a question somewhere?
Yeah. My question is, how are we going to deal to make the prices radically lower? We're not talking about 20 or 30%, radically lower to the top innovative drugs, so the majority of patients in countries like mine, which is not the poorest country at all, but others like Romania, Bulgaria, can get access to the innovative cancer and hepatitis C drugs. Thank you.
Thank you very much. How can we make the prices of drugs lower? It's an easy question. Yeah?
Much lower.
Much lower. Then it makes it more complicated. Is there anyone here who in the panel wants to say? Stan?
I think you're putting very good highlight in what I already said. We cannot simply invest in innovation and then nobody to be able, or only few people to be able to access the innovation. That's why I think the answer to your question is not easy, but this is the reason why we have the Access Partnership, bringing together the stakeholders, doctors, patients, politicians, also the industry, because I believe that no single stakeholder can find the solution of what you just mentioned, and this is only one dimension of the access issues we have. Think about the doctors, think about the pharmacists that are not there, it's everywhere, and all those issues need collaborative approach to be addressed. We cannot simply exclude the industry and say they are the bad guys. We cannot do that with the doctors and say they are the bad guys. We have to really find solutions that work for everyone, and I wouldn't agree with you that there aren't win-win solutions. I know there are win-win solutions, and we will find it, and hopefully we will do it within the concept of partnering between each other and to find the best possible thing for us and the patients, of course.
Thank you. Liana, short?
Yeah, short, one sentence. Maybe the one part of the solution is a transparency directive, which regarding the prices of medicines, but unfortunately it is stuck right now, and I hope that this situation will change soon.
Okay, next question we have, Annette.
Well, thank you for this initiative. I'm Annette Dumas from Alzheimer Europe. I'm here. I've got two things. First of all, I want to tell you that we have been working on a dementia monitor that benchmarks access to treatment, access to support, access to care in the different EU member states, and we would be happy to share all information we have with you. The other thing is a question. How are you going to work concretely with patient organizations, industry, professionals now? Because we are most willing to support your work and work with you, but concretely, how is it going to happen now? Thank you.
Thank you. Yeah.
Again, me? Yeah. I think we made really great step forward, having the Access Interest Group that was developed in close collaboration with politicians and the stakeholders. I think the Access Group would have the strong support from the stakeholders in the room, and also we will have the high expectations from the Access Group. I believe from now on, the stakeholders have to be proactive and really come with solutions that they think the solutions might work. And I'm sure that the politicians will find a way to bring the solutions to the table of the European institutions and to make them work for European citizens. So one of the ideas actually that we were discussing even this morning within the board of the European Patients Forum is to have kind of a regular meeting between policymakers, between the members of the parliament who are part of the Access Group and the patients' organizations, part of the European Patients Forum, who can actually exchange ideas and think how we can improve that on a regular basis. But not only. I believe solutions should go on your table, and you as politicians, I'm sure you will find a way to bring them further.
This is actually technical sentence. When I hear that stakeholders don't know how to support the platform, this is worrying. So that means we need, or you need, or the platform need to have an email address or something to be published to communicate to all stakeholders that if you, let's mention, you like to support the platform and also us as politicians to know what we should fight for, to have the address. So okay, good. Then we have the commitment from the platform, which should be the representative of all stakeholders, communicating the details, yes, no, how to contact the platform.
Okay, any more questions, please?
So I'm Adrian Vandenhoven, Director General of the EGA, Generic and Biosimilar Medicines Industry. First of all, just to congratulate Stanimir on a fantastic project and to see where you've taken this project from a couple of years ago to today with the Commissioner and so many important MEPs backing it. I think you've done a fantastic job. Just my question follows up a little bit from the question on the issue of access to medicines. Obviously, I'm from the medicines sector. I think one of the challenges, and maybe I'll be a bit more technical here than the previous speaker, one of the challenges is that over the last 15, let's say, or the last 10 years, Europeans have gotten used to the patent cliff. That is where very important, high volume, quite expensive medicines have come off patent, and therefore the medicines, let's say with generic medicines entering the market, you've had a lot of savings then and opportunities to increase access, to save money, and to keep the pharma budget sustainable. If you look at the future, where patents are going to go off over the next 5 years, over 50% are on specialty products like biologics, like respiratory products, products which are complex, which are challenging markets to enter. So there will be generic versions of those products, there will be biosimilar versions of those products, so there will be some price erosion, but it won't be the radical, let's say, price erosion that you've seen under the patent cliff period. So how are we going to work together, medicines industry, and I don't want to speak on behalf of the other side of the industry, but I think we do see on a high level eye to eye, but also stakeholders to address this challenge that while there will be competition, it will be very important for sustainability. It won't be the same huge effect of the patent cliff that people have gotten used to.
Was that a question?
Yes. I know it's a little bit technical, but I'm trying
I missed the question then.
Over the last 10 years, a certain number of very important medicines have come off patent, and there has been a huge price erosion due to generic competition in those. So a huge savings and opportunity to spend that money in different ways, either for better access or to buy expensive, let's say, innovative medicines. In the future, the molecules coming off patent are much more complex. 50% of them are specialty medicines, which means the price difference between the generic or biosimilar version and the original version will be less. So the amount of savings that there will be to spread around for better access or for new innovative medicines will also be less. So how are we going to deal with the fact that you'll have less room for maneuver in the pharma budget in the future? And can we work together to come up with solutions, basically?
The answer to that question is yes. Is there anyone who wants to...
Just a short answer doesn't answer the whole question, but I think it's one of the points might be more adequate use, because we very often do use pharmaceuticals where we don't need them, not the number we need. And I think with a lot of patients, when you talk to them, they do have at home a drawer where they have all the stuff they don't need, and they eat it when they think they should eat it. So I think it's also a question of health literacy, that you know what medicines you need, how long to take them, what's really appropriate, and the same is true for all the antibiotics, because we do have an antibiotics use in Europe that's really exploding. So I think that could be help a little. It's just a percentage, not the full package.
Okay, thank you. More questions? There's one. Please. Please make the question short and understandable.
Okay. I'm from APOSI, John Webber, from the patient part of APOSI, European Platform for Patient Organization, Science and Industry. So we are talking with the stakeholder all together about access. We have a few of these projects coming up from now on to April to the eHealth Week in Riga and in Luxembourg. My question is a very simple one, but a complex one to answer, is the following. We're talking about access in very different levels, but the communication and the literacy and the frailty things that are coming together in all these programs, as you said before, no one knows exactly where and when is it falling in this program or that program. Is that one of the, let's say, things you're taking by the horns, they say on Dutch? Is that the part where we can get in this access committee so that everyone knows where to talk to who in this access of programs?
That was an easy answer to that. It's a yes again.
Okay, good, perfect.
It's part of the, no matter, I'm serious, it's part of the ambition, absolutely. That goes with transparency, cross-communication and so forth. Without that, then it will be just some part of it, and there is only one way to move this in a true direction, and that is to do it in a holistic way where all aspects are involved. So that's why the answer is yes. We have one final question, please.
Yes, hello, my name is Mike Isles. I represent the European Alliance for Access to Safe Medicines. I think there's a good question here, I hope so anyway. It's to do with the Falsified Medicines Directive. As you know, the common logo, which will be required by each of the 28 member states to be displayed on an online pharmacy or retail portal. And each member state will be obliged to communicate to their citizens the purpose of the common logo and the fact it's secure and it's a proper way to buy your medicines online. For me, this is a unique opportunity to perhaps, and does the panel think it's a unique opportunity to monitor the activity of those member states, how they actually promulgate that, because clearly you have an opportunity to communicate with lots and lots of patients. Thank you.
I don't know the English word for it. In Swedish, it's ja. In English, it's yes, a little longer. I think it's a great opportunity, and I don't just see now how to do it, but I think we can communicate after this. Okay. Dr. Kovachev, you have some final teaser.
Yes, actually, before the closing remarks, so to close our inauguration meeting today, I would like to announce that among us is also one NGO, which is a very interesting idea to promote networking and best practices in endocrine oncology. And I welcome also the professor from Istanbul University and some of my friends from Bulgaria, Sven, Maria and Alexander, and wish all the best for creating this network. This is, I think, one of the points, best practice exchange and create good guidelines for 21st century adequate treatment and avoid unnecessary treatment. And second one, actually, I had as a closing to show you one short 3 minutes example of one access to dental care in Bulgaria, but unfortunately the technique here in this room is not the best one, so the video is not functioning. I will try to explain in 3 words. This is.
Shall we close our eyes so we can think it?
This is simply quite, I don't know, other member states I think as well, but in Bulgaria, in small villages, the access to dental care is an issue. And the project is as following: a mobile dental unit moving from one small city to another village and providing the treatment, especially for young people, but also for people who do not have the money to go to the big town or to the other adequate treatment. So I think such a project can be multiplied and could be also supported with some horizontal measure. I will try to support these people, but for the moment I have also doubts if we can do it. Again, thank you very much from my side to be all of us here, and looking forward to continue the cooperation with my colleagues, but also with the platform to find the best solutions for the European patients. Thank you.
Thank you. Thank you. And since time is running out, I would just say thank you very much to all of you who are in the room for taking your time, taking your interest and taking your commitment into this task. And we will contact you again. The information further on this will be on EPF's website, where you can follow it, and will be showing up there very, very shortly. And I also would like you to join me in thanking Dr. Kovachev for opening the door to the Parliament. Showing the confidence in what we wanted to do and to work with us and to open to other MEPs. I'm very happy for that. Thank you very much for that. Thank you. Thank you. So, yeah, it was
Ti se to bolje znaš. So, if you don't mind, we're going to start because, as I was told, at 4 o'clock this room will be closed and we have to leave. So therefore I decided, even if not all people arrived yet, that we start. Dear ladies and gentlemen, welcome to our discussion on dignity and justice for all, post-2015 Global Development Agenda, an event jointly organized by the Hans Seidel Stiftung, Konrad Adenauer Stiftung, the European Network of Political Foundation and the EPP Group. We are extremely delighted to be today in the European Parliament and would like to thank Davos Stier, Member of the Parliament and Rapporteur for Global Development Framework after 2015, as well as coordinator of the EPP Group in the Development Committee for hosting our event. Dear ladies and gentlemen, as we all know, the year 2015 marks the deadline for the first set of Millennium Development Goals. While the post-2015 Global Development Agenda is still under international negotiation, the discussion today provides the opportunity to focus on the EU's commitment and achievement for accelerating progress towards these goals, but also to discuss the remaining challenges for advancing the agenda in the run-up to the September summit this year. The EU made it clear in its recent Council conclusion on the post-2015 development that the interrelated challenges of eradicating poverty, fighting inequality, and achieving sustainable as well as inclusive development should be at the center of the EU's commitment. However, to achieve these goals, there is certainly the need to effectively address the structural causes. There is no doubt that the implementation and safeguarding of human rights are here essential. Following the post-2015 report of the EP's Committee of Development, this includes effective and inclusive democratic institutions, good governance and rule of law, as well as peace and security as a precondition for all human development. For long-standing actors in development cooperation, such as the political foundations, these areas are our core issues since many years. Through our wide range of activities, political foundations are experienced actors in supporting democracy and promoting human rights. And please allow me to say a few words about ENOP. With the European Network of Political Foundation, ENOP as the representative platform of currently 68 political foundations from 25 European countries. ENOP unites member foundations from all major party families at the European Parliament. The network currently also enjoys the financial support of the European Commission in the framework of the co-funded project that aims at building a bridge towards socio-political stakeholders for an effective EU development assistance and enhanced dialogue with the European Union's institutions. This means that this umbrella organization, ENOP, enable our members to participate in the dialogue with the EU and to feed in our expertise in the overall consultation process. Moreover, I'm proud to say that we are also supporting the European Year for Development, and through ENOP we also would like to make the contribution to raise awareness for development issues across Europe. Dear ladies and gentlemen, to make the new development agenda work, it is indispensable that all stakeholders can participate in the negotiation process and in an equal manner so that no one is leaving behind. And I would like to thank our speakers who joined us today at the podium, as well as to all the other participants for being with us today. Now I would like to pass the word to Davos Stier, who will give a keynote on good governance as an essential element of the new post-2015 framework. Please, Davos, the floor is yours. Thank you for your attention.
Thank you very much, and thank you all for the interest that you are showing for this topic, and also from my side, apologies for those of you who do not have or didn't find a seat, but this only expressed actually the huge interest of this topic, which is encouraging, being the case that we are in the European Year of Development, a year that is awaiting us with three key events. Of course, the first one being in Addis in July, with a conference of financing of development, which will have a huge impact, of course, for the next event, which will be the summit in September in New York for establishing the new global development framework, the new set of development goals that will replace the old Millennium Development Goals with new so-called SDGs, the Sustainable Development Goals. And then, of course, at the end of the year in Paris in December with the Conference of Parties in the UN Climate Change Conference. All three issues very much interlinked and essential for the development cooperations in the year ahead. I would like to very briefly also thank my colleagues, MEPs from various political groups, and a special, of course, also mention to Ingo Friedrich, our colleague as well from Bavaria that was with us in the Parliament and still very, very active now in these issues for his support. But now going to the question of the new development framework and where the emphasis in our view should be. Well, first of all, I think that it's fair to say that the Millennium Development Goals did achieve an important result in having, for example, extreme poverty, in having almost a billion people moving out from extreme poverty. But the new framework, if it wants to be really, truly transformative, should address not only the consequences, the symptoms, but go to the root causes of poverty, of inequality. And that is what we should stress also in the message that is coming from the Parliament. I look forward to the exchange of views, of course, with the experts that we have in this panel. I think that it's very important as well that we are changing the concept in development cooperation from the classical one of the industrialized, developed countries giving financial assistance to the developing world with setting goals that will be applicable only to developing countries, to a new framework under the principle of universality, where the goals will be applicable and the targets will be measured not only in developing countries but in every and each country. It's important to see, and I think that is also in the year of development where we are communicating to the EU citizens that we are tackling issues of poverty not only in developing countries, but there are also, of course, the importance of tackling poverty here in our continent as well, as and going to the root causes of that. So the universality is quite important. The second, I think that in the resolution that we passed in the Parliament in November, we expressed the importance also of the PCD, of the coherence that we need in our policies for development. And we are trying to do so. If you remember, for example, nowadays that we are discussing the TTIP, the transatlantic trade investment partnership with the United States, how that, for example, will have also an impact on developing countries. I think that it's important that when we are talking about trade and we are talking about agricultural policies, that we also factor in that equation what will be the effects for our development cooperation policies. And the Parliament is doing so, but also the EU in general. Of course, there is room for improvement, but it has already done a lot in this sense. At the end of the day, for example, the agriculture, which used to be a key standing block, for example, in the Doha round negotiations, in the meantime, for example, the EU reform is common agricultural policy. So those are issues that should be also analyzed, but we need to continue along that road of coherence in our policies for development. And of course, the need for a renewed global partnership where we are certainly, especially when we're talking about the means of implementation, is of encompassing in this development cooperation effort also emerging economies, also local, for example, communities, national parliaments, to be fully involved not only in the implementation but also in the decision-making process. and the question of financing as well, tackling the importance not only of the official development assistance, which is still important and we still need it, and here for the Parliament we are sending a strong message to Member States that they need to recommit to the 0.7% of GNA for official development assistance, but also to recognize that in the changed circumstances of our world, we need to encompass the role of the private sector and the role it can play in order to support the achievement of development goals. And yes, we need also to work more in sharing also policies, especially when it comes to the reform of the tax systems and to the effectiveness of the tax systems in developing countries. Just the fact that we got from the OECD that the increase of 1% in tax collection in developing countries will double the amount of official development assistance. So I think this gives you the proportion of how sharing policies and working on that issue is important. And of course, combating illicit capital flows. We have $1 trillion every year in illegal, illicit capital flows coming out from developing countries, ending, well, not to name names where the banks are, but actually talking about a sum that exceeds by far the official development assistance. We need to tackle this issue. And this is why we need to address the root causes of all these problems. And from our view, one of the key SDGs that are proposed in the new framework is building inclusive and effective institutions. Mm-hmm. This is the famous SDG 16. It was very difficult to come to it. We have, for example, in our committee a dilemma whether to reduce the number or suggest the reduction of numbers of goals or to keep the 17 proposed SDGs proposed by the UN Open Working Group. At the end, we decided not to reopen that package because we didn't want to risk any kind of new debate that could lead to the deletion of this most transformative, I would say, sustainable development goal, a goal that is really tackling the root causes of poverty, of inequality. Because we have seen in many cases from left-wing dictatorships as the Soviet Union to right-wing dictatorships as Pinochet's Chile, that extractive institutions, political and economic, could create some growth for some period of time, but they cannot sustain development. And this is the experience that we need to reflect also in this new approach if we really want to have a transformative agenda in development. So working on that, and the World Bank has also developed, for example, very good mechanisms how to measure good governance, how to measure the effectiveness and inclusiveness of institutions. I think that this is where we need to put the focus if we really want to move ahead with a transformative framework. At the end, I would say that we can have all the institutions and all the right policies, but always policies need to rely on a solid basis of understanding the dignity of the human being. If we neglect that, all the policies, all the political doctrines, or all the suggestions will fall and will be ineffective. The respect of the dignity, of the equal dignity of all human beings is essential. Now I am going a little bit philosophical, but actually this is a key. There is no example in history where a system that neglected human rights, that neglected the dignity of the human being was sustainable. At the end, it will fail and the cost will be enormous. So I think that going with a right-based approach, of course, human rights that are based, from a Christian democratic view, always on the natural law, but that also has its guarantees in international law, is an approach that we in the European Parliament find extremely important. That's why we are encouraged that so far we are making progress. The idea that we sent in November from the resolution of the European Parliament that we insist on the human rights approach, on building peaceful societies, inclusive, effective institutions, is really taken into account when it comes, for example, to the Council conclusions, but also we saw that reflected in the synthesis report made by the Secretary General of the United Nations, that where not only he also went along the lines that we were suggesting in the European Parliament of not reopening the 17 Sustainable Development Goals, but rather clustering them. He did that. And in that clustering, actually, one of the 6 pillars he chose, one is devoted to justice, exactly to this, to the good governance and building institutions. That's why we think that is extremely important to go with this message that we try to stress with the title of this panel discussion, and that is dignity and justice for all. So thank you very much for your attention. I'm looking forward, of course, to the exchange of views.
Thank you very much, and welcome everybody to this meeting. We will now start the panel discussion, which continues the theme, Dignity and Justice for All, the post-2015 Global Development Agenda. We have 4 very eminent, interesting panellists, and I hope we'll also be able to bring back Mr. Steyer into the discussion after we've heard from the panellists. My name is Catherine Woolard. I'm the director of EPLO, the European Peacebuilding Liaison Office. We're a network of organisations that work on peace and conflict issues. Our objective is for the European Union to be more active and more effective at preventing conflict and building peace. And we have been closely following the post-2015 debates. And of course, we look at the question of integration of peace into the emerging development framework. I think Mr. Steyer has very helpfully set out the key elements of our debate and discussion today. And I'll just highlight a few of those I hope we will return to. The first is complexity. We have 3 key events this year. 3 interlinked processes are coming together, and from that, a new framework will emerge. The second element is causes and coherence. I thought it was very welcome to hear the emphasis on the root causes of poverty. And it relates back to the coherence question, looking at all EU actions and activities and the impact that they have, which also takes us into questions of how EU policies may actually be causing conflict in some cases and need to be tackled at the European level. And the potential in other policy areas to relieve poverty, in trade, investment, and so on. The third element, universality, its implications, and I'd be particularly interested in hearing from the people in the audience here as well. What do you see as the implications and the potential of universality? And finally, controversy. Now, I think you left it very well with the focus on Goal 16, the goal that brings together governance and peace, and I hope will be the main theme of our discussions today. That goal was and remains very sensitive. It's true to say that many of the member states of the UN are not happy to see that goal there. And there has been a fight already, let us say, for it to remain part of the framework. Of course, now the process has moved to the development of targets, indicators for something that can be agreed in September. But we want to see how that Goal 16 is really fleshed out in the final document. And hoping that it indeed remains in there, because it's not entirely certain with the level of controversy that that will be the case. Let us now bring in our other speakers, and I'd like to start with Jean-Louis Ville, who is Head of Unit for Governance and Human Rights at DG DevCo, and I think therefore very well placed to go into more detail on this question of Goal 16. He brings to his current position more than 25 years' experience in the Commission, working on a whole range of different policy areas, which I think also takes us to the coherence and consistency question. Monsieur Ville, vous avez la parole.
Thank you very, very much, Chair. Good afternoon to everybody. I'm very impressed by this packed room, and I look forward for the debate. First of all, two things I'd like to say, to thank both, ENOP and the German Political Foundation, you, Mr. Stier, for organizing this event. I think it's very timely and very interesting, and also to have been able to gather such a distinguished panel. I was told I have 5 minutes to square the circle, which, of course, I will try to do, but it might be difficult to get there. A lot of things have been said, and I was reading through my notes before starting. I will not, again, insist on universality. I think the whole issue is very much there, to my view. I mean, if we look forward in an ideal world, what I would like to have as in, let's call it SDG for the sake of the exercise, would be something which is universal and very much on what you just both said. It's not an agenda from the north to the south, to make it short, and I don't want to be rude to anyone. It's just to be as short as possible and leave space for debate and question. It should be inclusive in the sense that everybody is concerned. I mean, you talked about coherence, there is also the external, internal, external coherence that we should look at. Because we in Europe, if we're talking as European, have a lot to things to improve. I mean, we are talking, just an example, access to justice. And I'm regularly confronted in my daily work to how to sketch an access to justice reform program in country XYZ. I know there are a lot of representatives of various embassies around. I will not name any country, not to create jealousies. But if we look at access to justice in our own countries, we must also look and consider and recognize perhaps that this is far from perfect in some cases, to say the least. So my view, and this is very much an idea which is going through more and more, and we hear more and more, and I think it's a good thing. It's certainly not only, like the MDGs were an agenda which is directed from one to another side. It's globally, it encompasses everybody. This is perhaps also the consequences of the fact that we are trying to marry both development and environment and climate change goals together, meaning the globality of the challenges are there and makes the whole agenda look a bit different. So clearly one is that. Another element in terms of governance from my little experience is that we should ensure participation of all. You've spoken about the citizens, but it's not only all the civil society. But clearly it's not only the usual suspects, and there again, don't take it personally, because a lot of NGOs are present in the room, and I'm very happy to work with them on a daily basis. We have authorities. These are the normal, usual, traditional partners with whom we are working in terms of development, or the development community very much. What is important is the local level, local authorities, which is an element we develop slowly, more and more now, but I mean, it needs to be taken into account, because speaking with the people in the capital doesn't mean we're speaking with the citizen or locally in huge countries. Sometimes it's very, very far. So local intermediary levels should be associated to the process. And this is of paramount importance for governance, because it's not only a government who will make the whole difference on its own. But it's not only the usual organization working on the field, it's also academia, it's also private sector that needs to be engaged in this process. We cannot leave out the whole discussion, the whole package, the whole deal, without taking into account everybody on board. Third element, well, that I think, and I'll stop there. So, well, the role of civil society. We traditionally have worked with civil society. We know that there are capacities in some countries, and it varies from one country to another. Definitely, we will, in my view, we should have a partnership where civil society is strongly entrained and strongly obviously they are committed, but I mean they should have a space in most of the countries so that they can apply or they can develop their capacity and put accountability on the shoulders of the authorities locally. And this is, of course, there where and I've touched upon, without naming them, key elements of what we describe as governance: freedom of expression, democratic institutions, etc., etc. Don't want to make the whole demonstration very long. Finally, one element which is, to my view, the key of the whole future process in the run is the measurability of this whole exercise. Numbers of things will rely on indicators. Mr. Steer, you've correctly pointed out the World Bank efforts, and there are some others, UNDP, a lot of NGOs have also their own indicators. There is a flood of indicators about governance or aspects of governance. Now, the difficult thing will be to choose, to pick the right ones, and second, to have the data availability, either by the authorities or by the NGOs or by whoever, ensure that the sources provide us elements that would help us to measure the result. That would be for my launch, and thank you very much.
Great, thank you very much, and I hope we'll bring you back into the discussion as well. Additional themes are stacking up. The question of participation, but I think the key issue of accountability. It's not just about building institutions, it's about building responsive, accountable institutions that serve the citizens and the populations of their countries. I would note that in the synthesis report, some of these elements are perhaps not that prominent. I mean, we see the impact of what has become an intergovernmental process, of course, with the state very much at the centre. Let's move now to our next speaker, and I'm delighted to introduce Dr. Helder da Costa, who is Secretary General of the G7 Plus Secretariat in Timor-Leste. He also brings more than 25 years' experience in development economics, aid effectiveness, management of development programmes, with a focus and expertise on the Southeast Asia, Australia and New Zealand region. I think Dr. da Costa's participation here represents a number of changing dynamics in the development landscape. One is the fact that Timor-Leste really is a driving force in a lot of debates on development and in shaping international policy frameworks, and that's something that's developed over the last 5 to 6 years, and I think very welcome. The second change is the importance of the G7 Plus grouping itself, and how this is providing a forum for a set of states to influence the agenda. So all of that, I think, also relates to the evolution of thinking on development, and part of which is embodied in the New Deal process, and I assume you'll also refer to that. Please, Dr. da Costa, you have the floor.
Thank you, Moderator. Honourable David Steer, European Union Parliament, distinguished guests, ladies and gentlemen. First of all, allow me to express my sincere gratitude to CAS, the organisers, for inviting me to participate in this important meeting. I'm making this short statement from a G7 Plus perspective, as you rightly pointed out. I'm representing the 20 fragile states, conflict-affected countries around the world, which is now totally number 20 countries around the world, which is chaired by the Minister of Finance from Sierra Leone. The G7 Plus Secretariat is based in Dili, Timor-Leste, as the hosting country. I will focus my intervention on 5 key elements that could be illustrated with brief examples from some of our G7 Plus member countries in the context of the global discussion on the post-2015 process, and 3 lessons learned from a G7 Plus perspective. First of all, I'd like to commend the European Union position on the post-2015. I'm glad to hear from Honourable David Steer that the European Parliament also supports this building peaceful societies and effective institutions. In 2016 is already articulated well in the UN Secretary General synthesis report, which was issued in December 2014. For us, the G7 Plus, we believe firmly that there can be no peace without development, and there can be no development without peace. If I may add, that there can be no institutions can be delivered without these 2 elements that I mentioned early on. So first, the establishment of a global development framework by the UN in the form of MDG is a step forward, enhancing the relevance of the UN system to all nations alike, including the fragile states. This is particularly true for fragile states, because the fact shows that no G7 plus country achieved any single MDG. Why is that? Because over the past 15 years, peace and security is already out of the agenda. We are the fragile states, we are in the bottom ladder of the development ladder, that we are fighting fires on a daily basis. We don't have time to pursue all those social goals within the 8 MDG goals. So now is the time for us, in the spirit of leaving no one behind, is that we need to factor in the peaceful societies and effective institutions in the post-2015. Otherwise, the risk is that those countries will be left behind again in the next 15 years. Secondly, every state is responsible to provide basic services, which is framed well nicely under the MDG to its citizens. So by helping strengthen the state institutions and its governance, in order to help us in a way that our development partners and also our recipient countries, we need to work together. The partnership is there. I think this is also stated very clearly and eloquently in the synthesis report under the so-called 6 elements of enhancing dignity by the UN Secretary General report in December this year. So by saying that helping strengthen the state institutions, what I mean is that you need to build up the institutions at those fragile states. I remember very well my chair, which is the Minister of Finance from Sierra Leone, he mentioned this. Now I am becoming more appreciative of the role and importance of institutions in fragile states. The case of Ebola could have been prevented, could have been abated, if the institutions were there, if the strong institutions are there. The fact that no ambulance, no infrastructure, no service delivery, and that exacerbated the problem of Ebola in Sierra Leone. So again, the lesson is that institutions matter in those fragile states. Thirdly, while effective governance is critical for sustainable development, it also depends on public institutions in all countries, and especially in fragile states, at all levels to be transparent, inclusive, responsive, and accountable to the people they serve. And I like the Honorable David Steer, the dignity of those people in fragile states need to be taken into account. Fourthly, all of these elements require investment in strengthening the rule of law and institutions, ensuring access to fair justice systems. People have a skeptic mindset about justice in fragile states, but you need to be with us in order to be able to build the justice system in those fragile states. And we, the G7+, we are very much looking forward to some of the indicators that might be possible going into the goal number 16, whatever it is, to look at some indicators on the rule of law. This is very important, so that it gives some positive progress from fragile states. And including measures to combat corruption, because the perception that corruption is happening in fragile states is paramount, and we need to change that. Including safeguards to protect personal safety, human rights, and fundamental freedoms. Lastly, while these elements are integral to sustainable development and apply universally to all countries, I like the universality point again, they are very critical to fragile states. And again, please don't undermine that the fragile states, we are fragile, but we're not fragile in mindset. We are fragile, we are resilient, in terms of trying to move out of fragility and moving towards resilience. But people sometimes undermine, you're fragile, so, it's a bunch of fragile states, So I sometimes feel a little bit, underaccomplished when I talk to people like this distinguished audience. Forgive me to say this. Now, 3 lessons learned. Our own resilience and development issues often gain through bitter experience, and reminds us that development goals can be reversed unless institutions are unable to maintain progress and hardly achieve gains. Let me give you an example. President of Nigeria, Jonathan Goodluck Jonathan. He once said this to President of Togo, where we had the ministerial meeting of G7+ last year. He said, Mr. President, this MDG thing, for the next 15 years, if we don't factor in security and peace in the next SDG, it will derail the whole development initiatives at the country level. And he has the point to say this. And this is what I want the European Union to take notice on that. Secondly, another important lesson we learned from fragile state situations is that local context and national ownership and leadership matters a lot. You know what? The former minister of South Sudan, who is now being demoted, He once said this in Busan when we launched the New Deal. He said this in 5 simple words. Nothing about us without us. In our development dialogue, in a policy discourse with our development partners, if you want to make a change at the country level, you need to talk to the local authorities, the civil society, whoever is the interlocutor of that particular country. So nothing about us without us matters in this whole development agenda. Lastly, the lesson we learn is that we are encouraged to see that the Secretary General has also mentioned paragraph 79 in his synthesis report about peace building and state building, reconciliation. They are critical countries to overcome fragility. And we would like to see this continue to maintain feature in the next post-2015 development agenda. The last but not least, the battle is now going to the United Nations headquarters. In particular, the Open Working Group, which comprises of diplomats around the world. So our strategy from the G7 Plus perspective is to also work together with the ministers, the political masters at the capital, so that they can instruct the diplomats in New York in order to be able to maintain those noble words that we are fighting for. Otherwise, you know, diplomats are diplomats. Those of you who are here, you might be experienced well in the United Nations. Every single comma, semicolon, they've debated it, you know. Yeah. Sometimes you lose the substance. But now, from us, this is the battle that we ask the European Union to support us and also this distinguished guest. Thank you. I'll stop here and I'll answer any questions later. Thank you.
Thank you very much. It was a truly excellent presentation, and I think from our side as a peace-building network, we would agree 100% with everything that you say, and highlighting those links between peace and development. But I also like the end note there with your reference to strategy, because now it is about the nitty-gritty of negotiations at the intergovernmental level and influencing that. Let us bring in our next speaker, Felix Fernandez-Shaw, who is one of the leads within the European Union on the post-2015 question. His position now is expert for post-2015 agenda and climate change in the cabinet of the new High Representative. Previously, he worked as Head of Division for Development Cooperation Coordination within the European External Action Service, and before that within the Spanish Diplomatic Service. And I think his very portfolio demonstrates some of the questions on the table, bringing together the development agenda and the sustainable development goals, the climate change combination, which is one of the key challenges of this year, I think. Please, Felix.
Thank you very much, Catherine, and thank you to Davos Teer for inviting us today, and to the German Political Foundation also. I'm, as Jean-Louis, as a civil servant, we're a bit shocked when we have all this, so we all, I think it's due partially to the recognition we owe to people like Dr. Da Costa and G7 Plus. In my experience in negotiating the Sustainable Development Goals in the Open Working Group, it was as refreshing, as relieving to always hear the G7 Plus hammering on the Goal 16 and on peaceful and sustainable societies. Why? Because we in the Union believe that this universal agenda has to be shared by everybody, and we at sometimes got confronted or got dug into a north-south divide or a confrontation by groups of countries, and I said again, it was very refreshing to hear the G7 Plus coming in and saying, this is for everybody, it's not something from the north, it's not from the south, it's something for the people. And this is where I think also we need to understand what is at stake here, what are we playing here in the post-2015. The first thing I would say is that maybe we should not say it's a global development agenda, we should say it's a global governance agenda. And the reason for that is that for the first time, I think, in world history, we are drawing up a set of policy goals, guidance and targets for any given governor and society in the world to run their shop. And this is something that is for the first time we're doing that. And it goes across all elements of society management, i.e. government. And this is, I think, a new approach that we need to take care of, we need to nourish very well so that it comes up. It also bridges a divide between some of the agendas, the peace agenda, the development agenda, the environment agenda. Some of them were a heritage probably of the Cold War, others not. But the truth is that this is for everybody. And when people like Dr. Da Costa say in the United Nations that peace, security, corruption is very important, it's not only important for the G7+. I personally hate saying fragile states. I personally think it's better to say states in fragile situations. But you can also say fragile institutions, but not states or countries. But it's not only for them. I think we in Europe have a lot to say about corruption, not precisely good. And I think it's all for us also to have goals on our side on well-functioning institutions. I think our societies need to improve as much as everybody else on corruption and the rule of law. And that is one of the things that is important of the universality is because this post-2015 agenda and because the climate change agenda are so ambitious, because we are getting into a global governance management dynamic, governance at national level, and as Jean-Louis was saying, governance at local and regional level is so important because we need to translate these goals, but we also need the people to feel safe, to feel comfortable that these goals, that these policies are being pushed. If we are to make change, if we are to transform our societies, to eradicate poverty and to have sustainable development through generations, and this is easily said, just like that, if we are to do that, it means a lot of people, many people in our world have to take difficult choices. Politicians, managers, agricultures, anybody has to take. Lots of people. We all need to start, turning our lights off. We don't need so many lights. We have to do that, and that will need a lot of governance in those countries, in all our countries. And governance helps people follow tough choices because governance makes sure that everybody has been consulted, that everybody has had their fair share of talking and speaking. And I say this in Parliament where I think it's the place where we do that. And everybody has had their fair share of, okay, I said what I had to say, I don't have the majority, everybody else thinks differently, I have to accept. And that also we have well-functioning institutions because if I don't like what I'm hearing, or if what I'm hearing is not what we agreed, I can challenge that. And I can go to court, I can go to justice, and I can challenge and make my rights effective. If all that goes in the right path, then we will be able to take tough choices on land, on oceans, on fishing, on all the other things that we have in post-2015. So the Sustainable Development Goals are not only about the governance and the dignity and justice for all, form the part of the European Union. There's an internal, intrinsic element of governance associated to it, but there's also effectiveness arguments that we need for the rest of the policies to work. As I said, and you said very well, Catherine, 2015 is the European Year for Development, and we have not only 3, we have 4 international conferences. We have one in Sendai in Japan on disaster risk reduction. These 4 conferences are going to set the tone for the next 15 years. What we're doing in these conferences is trying to agree globally to global rules. And as Federica Mogherini said in Riga in the launch of the European Year for Development, 2015 could be a silent landmark in history, just as 1815 was a silent, not too silent, landmark in European history. 2015 will probably be the year where we all understand that we've reached the global age, that we need to all talk to each other and we need to agree ways of working with each other so that we can eradicate poverty and have sustainable development for our future generations. But we need to do it together, and that's what the universality in post-2015 and the governance is all about. Thanks.
Thank you very much. And expressing there the high stakes that we have on the table this year. I think also the idea that governance and institutions are a precondition for meeting some of the other goals, which is an important part of our debate. I would like to bring in the final speaker. After that, I'll open the floor for your questions, comments, criticisms, reflections. So please be preparing your remarks now. And when we've heard from the final speaker, we'll open up and just indicate that you'd like to join the discussion. So with that, I'd like to introduce Damian Elie from ECDPM, the European Centre for Development Policy Management, where he's Deputy Head of the Strengthening European External Action Programme, working on strategic, political and institutional dimensions of EU development policy. He's also a visiting professor at the College of Europe in Bruges. Damian, please, your remarks.
Thank you, Catherine. Thank you very much to the organisers for inviting me and ECDPM to this impressive event. Maybe if my colleague had known that there would be so many people in the room, they would have sent a bigger shot from the organisation. But still, I'll try to do my best, and maybe also not to repeat what has just been said, with which I very much agree. I will try to maybe push the debate a little bit further, be a little bit more provocative in order to foster some questions and reactions from the audience. I think it's good to have organized this in January because it's still time to wish ourselves the best for the year. I'm saying this because post-2015 expert Jan van der Motele recently told us in ECDPM that the SDG sound a little bit like a New Year resolution. In the sense that we all believe in it, but we're not sure we will be able to walk the talk along the way. And I think that should be the starting point. You know, we talked about Christmas tree or a flea market, but I think the New Year resolution as a metaphor is quite strong, but also quite true for the SDGs. So let's not deceive ourselves. I think the balance between, on the one hand, universality, and on the other, differentiation, will be the key of the success of the negotiations, but also of the years to come. Because it's all about, in the end, once we have agreed with these good, nice principles, it's about the how and the implementation. And it's about how to balance all this universality with a differentiated responsibility in implementing them, a differentiated responsibility in assisting others. Let's look at the realities. There is asymmetry in this world, and the EU is part of it. So my question here would be, what is the EU going to do to work on this balance between universality and differentiation? Differentiation is also something that is called for by groups of organizations which advocate in favor of a special treatment because of their different situations, economic, fragility related, and so on. I see the EU in this game playing the role of an enabling power. I think what the SDG will need will be an enabling environment, and I think the EU is probably very well placed to be this role of an enabling power. Now the question is the EU well equipped to do that? Is the agenda for change enough? We're waiting for a new communication this year, as far as I understood. How far will the changes be made in the EU policy system to match the SDGs? My impression is that actually the SDGs reflect already quite well EU development policies, and that the EU has done quite a good job in making this happen at the global level. So I think the agenda for change is already an efficient roadmap. It has to be updated, of course, and adjusted to the SDGs. But then is, what do we do in country in order to implement and to apply differentiation in the mindset of universality? And here we get back to old issues like political dialogue with third countries and their authorities, the quality of the political dialogue and the political dimension of our development cooperation, which is something that has been a long-lasting challenge for the EU. And when we speak about EU's presence in third countries, it is also going to be about the role of EU delegations. And as I was saying this morning in another meeting in this building in the Parliament, we are entering a phase of more with less. There are increasing demands for the EU to deliver internationally, but there is also increasing pressure in terms of resources, capacities, including staff. So how is the EU going to deal with these challenges in order to walk the talk of this New Year resolution? I think the potential is there, talents are there, but it would be interesting to discuss this all together. So just to maybe summarize, and maybe last point on the global dimension of the SDGs and the universality principle, the global dimensions of governance. Long talks about fairness in sharing power at the global level. The EU hasn't made a lot of progress on this issue. We still have 2 permanent members of the UN Security Council which are members of the EU. There is a lot of requests, a full amount of demands to change this system. Is the EU ready to change this situation? Are these 2 member states ready to maybe upgrade the way they are responsible vis-à-vis other EU member states and vis-à-vis the world regarding this global level of governance? I think this probably will remain one of the toughest challenges to be tackled by the EU to walk the talk of the SDGs. So again, how to manage this balance between universality and differentiation. Thank you for your attention.
Thank you very much. And with that, I'd like to open the floor. And I think that final point is a very interesting one as well. We focus and talk a lot about institutions in developing countries, institutions in fragile states. There's also the question of multilateral institutions, of course, and reform of the international system as a whole. If this is to be the new framework for global governance, those issues cannot be dodged for much longer. And I think Damien also raises the question there of the effectiveness of the EU's tools, activities in practice. The EU has solid principles, it has often very good policy. The question is what's happening in practice at the end of the policy chain, in delegations, are the resources and the capacities there? So I'm still talking as I wait for hands to go up for people to join the discussion. If you could introduce yourself when you make your points. Thank you. Let's start there, please.
Thank you very much. My name is Tanya Cox and I work for Plan International, but I'm also the co-chair of the Beyond 2015 campaign in Europe. Thank you very much for this very interesting debate, and I agree with everything that's been said. I suppose one of the things I wanted to raise is, you've just partly mentioned, Catherine, we've talked a lot about the participation aspect of governance and what we need, but we haven't talked so much about the equitable management of all resources, and that is absolutely critical to governance, fair, just governance. And we can be talking about economic resources just as we could be talking about natural resources or access to social services. But this is critical. And it's going to be absolutely critical if we want to reduce inequality. And I think that we shouldn't lose sight of that as being one of the key aims of the post-2015 framework. Inequality within countries and inequality between countries. Now, this equitable management of resources is key at local level, it's key at national level, but it's also key at international level. And that was a little bit what I was missing from the speakers' presentations so far, this international angle. I think we need to be querying the huge power of some of, say, the G groups like G8, G20 and so on, also of IFIs and the like. So maybe if speakers would be kind enough to say something about that, because we haven't got much so far in the framework on any of this. And there seems to be less and less room for manoeuvre to be opening up what we've agreed so far. So how do we square that one? Secondly, I didn't hear much about accountability. And accountability is absolutely critical to just governance. And I think there's a confusion, if I'm going to be putting it politely, but perhaps also people are reticent of talking about anything more than monitoring and reporting, review of this future framework. Now, that is not accountability. But unfortunately, accountability is now being touted as a bit of a dirty word. So we in civil society are beginning to say, what can we do to get around using that word? Well, is this the way forward? Is this how it should be? Anyway, I know states don't like being held accountable, but when you make a commitment like you're going to be, or states are going to be in the post-2015 framework, it would be nice to have more than just monitoring and reporting. And then lastly, in a slight response to Damien at the end there, if you look at the EC work programme for 2015, I think we can say that no, a lot of the policies so far are not living up to a sustainable development agenda. The work programme for 2015 is completely out of step with the aims of the Sustainable Development Framework. And I'm very much hoping that going forward in future years it will get much more in step, because currently it is just about growth in Europe and jobs in Europe, and nothing about any changes that Europe might be needing to make. I'll stop there. Thank you very much.
Thank you very much. A set of extremely interesting points. On inequality, I think it's interesting how well it is highlighted in the synthesis report. The question is then what comes out in the goals, perhaps. I had a question at the back. Deirdre.
Deirdre de Burke, I work with World Vision, an international child-focused NGO, but I'm also a member of the Beyond 2015 steering group. And a lot of very interesting questions were posed by the speakers there, and thank you for a very interesting overview of the issues, coherence, complexity, universality, and so on. And I'm afraid I have another question to pose, which doesn't necessarily simplify matters, but it's the whole question of how will this hugely ambitious, very exciting global framework be implemented in terms of finances. So my question really is about whether the whole question of innovative finance has been really thought through by the global community. When we do talk about innovative finance, we talk about possibly things like domestic resource mobilisation within developing countries. We talk about taxing international financial transactions and maybe closing down tax havens and so on. But to my mind, if we're talking about this particular framework, which is a 15-year framework, we need to be thinking about a way or systems of financing that are going to allow us to be able to implement the framework from the word go. Many of these systems, even though they're a very good idea, the sources of innovative finance, they're going to take years before they really come to fruition, before, let's say, for example, domestic resource mobilisation is going to really enable developing countries to be able to implement many of the goals set out. So my first question, is there a willingness on the part of the international community to really think outside of the box in terms of innovative finance? And if so, what kind of thinking is going on? Thank you.
Thank you very much. And I think we'll come back to the panel shortly. I'll take 4 or 5 points from the audience before we do that. And it would be interesting to hear views on the Addis discussions and the links between these different frameworks. And I think also the system of financing for the SDG, whatever comes into place, but also the relationship between trade and investment flows and the SDG. Will it be used as a framework, a checklist, to look at those other actions, which would have implications for the EU as well? We have the next person along. Thank you.
My name is Richard Young, so I work in the Carnegie Endowment for International Peace. I have one very brief question. All the speakers emphasised the importance of democratic governance as a principle. I just wonder what they thought the EU should do tactically in countries that are clearly not democratic and in no way committed to implementing democratic reforms. I mean, the EU has been pumping hundreds of millions of euros into many countries whose record on democracy and human rights has got appreciably worse in recent years. I just wondered what the EU will do differently after 2015, because it seems to me the challenge is not simply to have a development agenda that is a little bit more politically sensitive, but to rethink the whole kind of panoply of foreign policy instruments so the EU can actually make a difference in what we're actually seeing at the moment, which is quite a pushback against democratic norms around the world.
Thank you very much. And I think with particular relevance, for instance, for states that are increasingly autocratic, where there's a backlash against civil society, what should the EU be doing in these kind of circumstances? Could we have 1 or 2 more before we come back to the panel? Thank you, sir.
Yes, hello. I'm Christophe Yvetot. I represent the United Nations Industrial Development Organization, and I'd like to congratulate all the speakers for what they have expressed, and would like to compliment particularly on the role of the private sector in the post-2015 agenda. We were given the responsibility to consult the private sector globally. So we have conducted consultation both at I would say regional level, at country level, etc. And through this consultation, there's a report that I can give you, and you can find in unido.org website. And some recommendations were given by the private sector that we recapped and that give very quickly, not all of them. First, that as in the issue of governance is very important, and in many ways we've seen that the private sector, particularly if we talk about SMEs, because big companies, they have, of course, a lobbying power, we know, but SMEs have not been that consulted, and this is very important that we could, in the means of implementation, this would be captured, because it's very important that this dialogue at a local level, it can be with local authority, governmental authority. This exchange of view and participation in the decision making is very important. 80 to 90% of jobs are created in SMEs. So I think it's just this is very important to note, to make sure that they are included in this. And of course, the fact that now we see an emphasis on the private sector doesn't mean that we should forget the public institutions, because for the private sector to prosper, you need also to support institutions. The second point is also, and it's connected, is also to make sure that we localize the architecture for SME engagement. As I said, in the globalization, you have very fast and powerful players, but you also have those local SMEs. We need to make sure that the decision-making and their voice is heard at all levels. And then it's also very important to build trust through enhanced transparency and accountability. That's why it's very important also to put in place measurement practices, reporting standards, and certificate schemes that can measure, for example, how CSR, corporate social responsibility, for example, is implemented, or many ways of measuring that what the private sector does will contribute to our global objective of reducing poverty, sharing prosperity, and of course moving toward a sustainable industrialization. Thank you very much.
Thank you very much. At this stage, I'll bring back the panellists for answers to some of the questions we've heard. We'll then come back to the audience for additional questions and comments if you have any more remarks to make. I'd like to kick off with Mr. Da Costa, and if I could ask you to address in particular this question of financing and financing systems, as this is one of your many areas of expertise, in fact. Thank you.
I'm nervous when it comes to finance, but let alone when the G7 plus countries are poor, but they are rich in natural resources. And I want to address the question by Tanya from Plan International. I know that the financing issue will be discussed in Addis Ababa this year. So let's wait until the United Nations organize this meeting, and then we'll invite member countries to come and discuss this, whatever innovative financing mechanisms and modalities will be discussed in that meeting, so I'll respect to that. But I'd like to tackle a point that is raised very important on natural resources. You can understand that in the space of 5 minutes we can't talk everything, right? But it is, from my perspective, who represents the G7 plus perspective, natural resource management is now becoming, I would say, the sexy issue now within the G7+. Why is that? Because everybody says that countries in 20 countries across the Pacific, Asia, Middle East, Africa, and Haiti. Haiti is one of our member states. They are rich in natural resources. And behind the scene, we have now prepared a major study to be published by the Secretariat at the end of March this year here in Brussels on natural resource management in G7 plus countries. That in itself includes some of the legal framework, some of the parameters where multinational companies operate in G7 plus countries, and what are the implications for the way forward. We have had huge examples of countries taking multinational companies to The Hague and to the other thing because of the experience that people take advantage of resource endowments possessed by those countries. So in pragmatic form, madam, I would say that the G7 Plus is now promoting the so-called F2F initiative, the fragile to fragile initiative, in three major areas. Firstly, on peace and reconciliation. Mm-hmm. That's why the experience of Guinea-Bissau becoming another normal country, thanks to the G7 Plus policy on peace and reconciliation. Secondly, on natural resource management. And the third issue is on public financial management. How do we generate revenues? How do we budget? How do we put country system into place under the spirit of the New Deal? So those three elements are now becoming more like a policy among the G7 plus countries. Now, at the global level, of course, you know better than I do that international financial institutions, IFCs, and all the other major institutions are now also talk about this private sector development you're talking about. And this is also, I believe, that is going to be featured prominently in the next 6 months in the debate within things. So for us, to end, my point is that we need to diversify domestic resource mobilization, the issue that raised by a lady in the back there. That not only as a recipient country, but also we want to generate income from our own resources so that we can deliver the service to the well-being of the people at the country level. That's very important. Because the GCM Plus, now we believe that we don't need more money from our development partners. All we need is the level of assistance that they have provided is how to make it more effective and make it more efficient to the better use of the public finance that you provide to us. So for us, combined with the natural resource management in a proper way, resource wisely, manage it wisely, so that in a transparent way, so that we can deliver the service. Timor-Leste has a good example. The resources that we generate from the petroleum fund, we put aside, and now we have almost $16 billion in the Reserve Bank in order to safeguard for future generations. This is a classic example of how you manage the resource in an equitable way so that you can contribute to the people and also to the region wherever. And we even now trying to help other countries in need in natural disasters. So to end this point, I'm sorry that I can't answer convincingly on the financing side because I'm not expert. Yeah. But at least these are the initiatives behind the scenes in a small way, small baby steps that the G7 plus countries are doing at the moment. Thank you.
Thank you. Very, very useful again. And I'd like to hand the floor now back to our host, Mr. Steyer, for his remarks in answer to the question, but also reflections on the other speakers' presentations, if you have anything, please.
Well, thank you. There were several questions. I would like to just refer to some of them, especially when it comes to the question of the tactics of the European Union towards those regimes that are less and less democratic or are going backwards. But also, I think that in the answer we can touch upon some other issues that were raised as well. First of all, I think that there is one element, it was not mentioned before, but that we should also take into account, and especially after the attacks in Paris. And there is a question there, especially when it comes to relations with third countries, whether we will go into a position that as long as you combat radicalism, as long as you combat, for example, the Islamic State or so-called Islamic State, we will be tolerant to corruption and to this kind of stuff. I think that the question is a legitimate one, but I think that the answer also is quite clear. On one side, and we see some examples, not entirely along these lines, but we see some examples where you have tough choices. For example, I will name some names. We had debates, for example, in the last plenary session in Strasbourg about the situation in Egypt. Mm-hmm. In Egypt, what do you do there? We are seeing, of course, that the stability of Egypt is critical to our own security in Europe. We don't want radical elements to destabilize Egypt. On the other side, should we turn blind on some, very evident signs of growing or authoritarian or not going into the democratization process fast enough or fast as they even could, given the circumstances? So I think that one orthodox way to answer to that dilemma is that we really need to strike a balance. Yes, we need the stability there, but we should insist also on Egypt to do reforms in order to go into the democratization that is needed. Otherwise, we will be just not only delaying but creating more problems, not only for development but for combating, the radicalization that actually is one of the aims. So that is one thing. But there are some other issues that probably require a more unorthodox answer. And that is, or a little bit more provocative thinking. And that is, of course, that we are seeing some emerging economies that have been profiting, for example, from Europe opening its markets, from the US opening its markets, but they are still protecting theirs, which, of course, created an advantage in terms of growing the economies in the countries that we call the BRICS. Yeah? And that are trying to also sometimes portray themselves as a sort of voice of all the developing countries, which is not exactly the case. When it comes, for example, to trade policies and to go with TTIP with the US, of course that the EU here is taking some steps that will have an impact on the position of the BRICS countries in the global scene. Is this positive or negative? Well, I will argue this. Some of these countries were using this economic growth. That economic growth was fueling attempts to go backwards in terms of democratization. And let me put very bluntly, I think this is one of the examples that we are seeing in Turkey, for example, or in Russia. Yeah? And I think that from that point of view, having again strengthened the position of the EU, yes, and the US, in the global scene, it will strengthen also, if you want, the formula that we think is essential for sustainable development, a formula of inclusive, democratic institutions. So I think that we also should look at these areas from this development perspective as well. And this is when, for example, we are talking about the work program of the Commission. Yes, TTIP is, for example, very important. I wouldn't say that this is exclusive. Yes, primarily is about growth and jobs in Europe. But it has, or it could have, if properly addressed, a positive impact also on our development cooperation policies. So I know that it's a little bit unorthodox thinking, but I just wanted to also be a little bit provocative from my side.
Thank you very much. Could I ask Mr. Ville to come back into the discussion, and with particular reference to this question of democratic governance? What can and should the EU be doing in situations where it is engaged with and perhaps even providing budget support or funding a state where there, rather than democratic consolidation, there is even a move away from democracy, that sort of highly sensitive situation?
Thank you. I expected this question to come, and thank you, Richard, for raising it. Well, if I were to stick to the book and the policies, normally, and I refer to the more and more communication, which was, it seems to me so long ago, but in fact it was only 3 years ago, which is not that far. We would say at the time, if you're behaving well, sorry to make shortcuts again, you'll receive more. With the, it was not expressly said, if you are behaving not so goodly, also not so rightly, you should perhaps not receive less, but at least remain at the stage. And if it's totally impossible to work within your country because you're not a respectable government, then we will switch from government to government into more directly support or direct support to civil society organization in the country. Now, until last year, I would have felt comfortable with that, in the sense that we have examples where budget support more and more, or more and steady position was functioning, and we had the good example of the worst country that was behaving so badly that we were not able to cooperate, and we were just doing civil society, or a large share of our cooperation through civil society. Well, of course, now Egypt comes or is getting through a different path, and you're absolutely right in saying, well, Egypt is very important from for a security point of view, seen from Europe, knowing that the situation in the country is more degrading than improving. Sorry. Now, I would say development policy needs to be trained in a global foreign relation scheme. I mean, we cannot forget what are our strategic interests when we have a relation with X or Y or Z country. And this is, of course, this is the difficult point. Because I'm charged of defending human rights and fundamental values when we assess the situation in the country to whether or not we're going to provide, or whether or not the conditions are fulfilled to provide budget support. Do we trust or do we believe that the situation in the country, according to indicators, etc., are fulfilled or are more or less acceptable from their level, so that we can go into that country? And of course, if you ask me what I think about Egypt, I think there's no doubt. I mean, it's not even necessary to ask me the question, you will know the answer. Because according to all internationally recognized criteria or indexes, World Bank, UNDP, Transparency International, whoever, you name it, chose one, Bertelsmann, you will have an answer which is strongly negative. So consequently, if I'm if I'm logical with myself, and I should advise my Director General, my Commissioner, whoever the Commission, not to do that. And of course, on the other hand, you have other aspects: security, relations, strategic position in a region, other commercial is not necessarily the case for us for Egypt, which are counterbalancing that, and there is a debate. So what can we do? I mean, engage with Egypt at political level. Somebody, I don't know who, I think it was perhaps Felix, who mentioned the political dialogue and the quality of the political dialogue. This is the way. I mean, we need to talk to the authorities in Egypt and, okay, of course you're a sovereign country, but you're not perhaps behaving the way you're expected to, and be aware that this is something we don't like so much. But I mean, this is only one thing, and of course the Egyptian government, rightly so, will say, okay, politely listen perhaps to us and say, okay, we've heard you, thank you very much, and we will think about it. So, addressing, I would say very much what you say, Mr. Steyer, as addressing to convince the government to start reforms, not necessarily to degrade. Let's not make the revolution a second time. Say, change the constitution and go for the big bang story, starting from the constitution, new elections, etc. But I mean, in that case, I would recommend try to address reform in certain sectors, starting from the bottom, perhaps in a non-controversial area, health, education, I don't know. To be seen, where you can try to imprint some principles about non-discrimination, about access, etc., which would address the citizens' concern more than everything, and try to slowly and gradually increase or improve the situation in that sector. But of course, it will take a long time. It's not something that will happen overnight, as we used to say. Difficult. And the national context, obviously, is very, very important in that case, because what suits to a country A will not work, certainly, in a country B or in another one. I don't think I have a better answer for the moment.
Thank you very much. And I think there you're touching upon a number of very sensitive and dilemmas, in fact, isn't it? And I think the issues we might throw back to the audience, the question of what leverage does the EU have in these kind of circumstances? Is it using it? But I think it's also interesting to look at the questions of approaches to security. As you say, in many ways we may be in an era where certain security considerations seem to take priority. From our perspective as a peace-building network, we question whether those approaches to security are actually productive. Tackling counter-terrorism, there are different ways to do that, including looking at the root causes of terrorism and radicalisation, which may themselves lie in poor governance and corruption. I think also the question that will be part of the debate over this year of whether certain aspects of counter-terrorism should trump all other considerations, even given the sensitive time that we live in. I'd like to bring in our final two panellists with answers to questions. We then have time for maybe one or two remarks and we'll wrap up. But Felix, I would like to ask you specifically about this question of accountability that was raised at the beginning by Tanya. Within the framework that's developed, and you rightly explain how important it is monitoring sufficient? Are there other ways to build in accountability so that if states, governments, donors, whoever, institutions don't deliver, they can be held to account?
Okay. I was very happy you endorsed the one on democracy, not democracy, to Jean-Louis. Thanks, Jean-Louis. But on the accountability, Tanya is usually, setting us up for the good questions also. And yes, I think monitoring and accountability are part of the show. And in order for all of us to agree on a global set of goals, you need to make sure that when you're starting to deliver, everybody else is delivering. I mean, if you take the UN crowd, or the countries represented in the UN crowd, by the diplomats. I'm sorry, being a professional diplomat, I like it when people say they're diplomats in New York. In fragile situations, sorry. No. But I think it's massively important that what we negotiate and we agree on, that then, as I said, as part of the governance scheme, it's delivered. And then that people are held up to, people, countries, governments, societies are held up to what they have signed up to. Now, of course, the SDGs is not a legally binding framework. The climate change is a legally binding framework. We'll see where that takes us. But I think the whole process around this SDGs and the accountability of it make it a bit more than just a political framework. And the past experience in the MDGs, where I think we've all been paying tribute to the massive amount of progress that the MDGs have ushered in, at the same time the massive amount of progress that we still need to do, it's because we have been monitoring and we have been able to take note of what's going on, and we are holding ourselves accountable. That, I think, also is going to bring a important revolution in the way in which we do business in development policy. Because by agreeing to a set of global goals, which all of us have agreed to, all of us means all of us. And therefore, it's going to be, the difference from the MDGs is going to be that, of course, we as donors, we the Union, and as the G7 as anybody else, we're going to be obliged, because we cannot say to any country like Timor-Leste, we cannot say, this goal you've chosen, no, but we just agreed it last year in New York, so this is the goal we all agreed to, you have to support my policies in delivering that goal. And that's going to bring a lot of change to the way in which we do business, and I hope it's going to deliver good change. Thanks.
Thank you. Very diplomatic answer. So I'd like to bring in Damian, and then I have two people who've asked for questions or comments, a third one there, and with that we'll probably wrap up unless anybody else is desperate to join the discussion. No. So Damian, responses to the questions we've had so far.
Very, very quickly to leave time to Q&A. I was mostly referring to the agenda for change when I was saying that the EU has managed to bring it to the global level in terms of governance, human rights, civil society engagement. And I agree with you in terms of work program for the Commission. There will be some adjustment, I'm sure, once the negotiations is finished. There will have to be to take that into account. On democracy support or a new approach, I think there's something simmering in the EU system about civil society engagement. There's been new tools being put in place, and now there are experiments to do things differently at the level of EU delegations. We are engaged, for instance, in Madagascar to work with the delegation to approach civil society engagement in a different way, also maybe using the new tool of trust funds. So I think there is some, the EU is a slow-moving beast. So sometimes change is not visible, but it may be experimented here and there. So in that sense, I think we should be optimistic. Then, yes, there are strategic issues. As far as the neighborhood is concerned, they were discussed, and I will not repeat that. But again, and I also agree very much with Dr. Da Costa, very often it's not a matter of money anymore. And there's a lot of funds available. And the question is, the Czech diplomacy of the EU is over, and it has to be behind us. And I think we are perhaps entering a new era now where, EU representatives do not only list the amount of millions of euros they've been committing to such and such country. I think we're beyond that, but still, I think the key word in the Secretary General synthesis report is dignity. It appears many different times, much more than in the OWG report. And dignity goes, you said it, it's a bit philosophical, but I think it's very cultural. And here I would like to refer to what Pierre Vimont often says, that the EU has to be more in a listening mode. He said that several times in public events in the framework of the EU Preparatory Action on Culture in External Relations. And I think this cultural dimension is very much related to dignity. And dignity in development policy will have to connect with cultural relations. And this is a new territory that the EU has just started to embark on. And I think it is part of the solution in a way. And I agree again, not legally binding. Monitoring is going to be done on a voluntary basis. It is what the documents say. We really need to read that carefully. What does it mean on a voluntary basis? Not speaking of the data revolution, which has not really happened and will take time to happen. Thank you very much.
Yeah, I would say the word that appears most often in the report is probably data rather than dignity. One reason or another. We've got three final questions or comments, please, at the back, Patrick.
Thank you very much, Catherine. I'm Patrick Leusch, Head of International Affairs at Deutsche Welle Academy, which is a bigger media development implementer in Germany, and I'm the Secretary General of the Global Forum for Media Development, which is the network of the media development organizations. First of all, I noticed very positively the unattended and unquestioned commitment to Goal 16 and this idea of governance, and I loved very much what Davos said in order to turn the whole thing on other feet, saying that this is about global society management, and therefore all these aspects of governance and so on must be in, and that's great. Nevertheless, during the discussion, my impression was that this commitment dropped a little bit and clashed a little bit with what is the diplomatic reality. Because on the other hand, I mean, the EU is by far the largest donor, first of all. Second, it is the largest group of states. And obviously there are other states showing up with their own interests in that whole discussion that is now on, both from the climate side, from the energy side, from the development side. So everything is integrated, and new economies are coming up with other ideas, trying to find alliances by other means than we did formerly. Then you have the US and all that kind of stuff. In a nutshell, I'm wondering how the EU is going to use its power, its political power, its financial power, and also obviously its power that is bound to values, because everybody is saying, yeah, we are discussing dignity and universality, values we share. So there is something to defend. And I'm wondering, and that is my question, how is the EU going to use its power and its push? I wasn't sure by what I heard here that the EU tries to get a leading role in it. So is the EU following some member states that make a strong word for something, or what does that mean? And particularly, to bring it really on a point, I think that, obviously, while I'm coming from media, when you look into Goal 16, something will remain about Goal 16 and governance. I think that is more or less committed. Even China will say yes, apart from North Korea maybe. But then we have 1610. And that is much more specific, and it leads to participation of people, it leads to access to information, which is absolutely crucial. How far is the EU willing to defend really the sensitive issues at the end of the day? And I'm very much interested in that.
Thank you, and I think it takes us to the question of the will might be there, but what power does the EU have within an intergovernmental process? Are the EU member states also reinforcing some of these points and fighting for some of these sensitive issues? Could we take this point here, if you can head to a mic?
Thanks. Yes, I think I can use this micro. Yes, my name is Adele Orris. I'm from the European External Action Service, and Felix and Jean-Louis know me quite well. I'm the policy lead on governance and human rights in post-2015. Of course, I'm not asking a question to my colleagues up here, but I would just like to make some remarks and also give some update on the process, so that maybe people, I see a lot of civil society representatives are in here, maybe have a feeling, what can we do or what can't we do? Like, I just heard that question from, we also met in another discussion before. You all know, those who have followed the process, that we have the proposal from the Open Working Group, and we had been discussing a lot the Goal 16. And I just would like to draw your attention a little bit to the fact that this document, it has been negotiated for quite a long time, and a lot of people have spent a lot of time and energy into this, exchanging arguments and whatsoever. And the feeling is that this is more or less quite a balanced document, because everything is in there, nothing is really missing, and of course no one is 100% happy. But that's the way it is. When you agree on something in the international arena, you will never get something that everybody 100% agrees on. So this is something that is so far a document that most people can live with. And so there's not really much appetite for opening this up, because a lot of people fear, okay, but when we're trying to trigger or change some things here and there, some slightly changing some words, then you enter into a more deeper discussion, and then you might start opening up the whole thing. And so I think we somehow should take into account that this will be the document we will have in the end. Let's say the goals and targets we have. There might be maybe some technical changes, some technical adjustments for things that might not be measurable or might not really make sense whatsoever. But this maybe is the document we have, the goals and targets. And then what is left for us to do? I think then we should have a close look and see how can we get the best out of the document, out of these goals and targets. And then it comes to the very tricky and technical issue of measuring. How do we measure what is in there? and how do we measure it in a way that it makes sense, that it really delivers on the things we want to have, and that it really delivers the change we want to see everywhere. And this, I have to say, is really still a huge task ahead of us, to find the right statistics, the right way of getting the data we need, and of course getting the data that can be compared. Because this is not so easy, and this really is a huge task also when it comes to the amount of data. And I think we also have to take into account that this is something that administrations, they have to shoulder it, they have to do it. So we also should maybe have, or ask ourselves, do we want to overburden maybe some administrations so that in the end we're drowning in data and we don't know, so where is actually the most important point it is. So yeah, this is still unclear, and there we need to invest a lot of it. And yeah, and then there had been some questions on how do we make sure that this has an impact and this will be monitored. It has been a lot asked, what can the EU do? I would say a lot depends on the citizens and on the consumers, because the people, they will ask their government, so why is it still not possible for me to get a passport? Why is it still not possible for me to get some information about what my government is doing? Excuse me. So I think it is very important for us also to empower citizens and ordinary people, to tell them what is this agenda about and why is it important, so that people ask questions and ask their own government, so what are you doing on this? Are you delivering on this? Are you taking this serious? This is maybe a point that I would also give to civil society in here. Talk about this agenda and discuss it and make it known, because I'm quite sure a lot of people, they still don't know what is going on and why is this important. Thanks.
Thank you for the very helpful update from the EAS side. Because we're nearly out of time, I'd like to hear, Sabina had a question or comment.
I know I had already my part in the discussion with the opening, so I tried to be very short. But no, it was such an inspiring debate, and I would like just to make one short remark. When I was listening, so we talked a lot about structures, institutions, in governmental reforms, mechanism, measurability, and documents, and something. And I was starting to think, I mean, all the reforms is about to set some kind of a stage for democratic development, and there is a mindset among the people necessary, you know, to see the function and the delivery of services of the state differently. I think in a lot of development countries, but also maybe in the developed countries, let's talk about some Balkan states where I have maybe most of my personal experience made, people do not expect something different from the state than to be corrupt or to have only vested interests. So what I think what we should not forget in the whole debate is to talk about people. And I think Jean-Louis mentioned local authority, so that, of course, the local context is important, but it's not only about NGOs and local authority as such. And I know the European Union maybe has sometimes difficulties when we are talking about how to work with political parties in these countries. Because, of course, yes, they are not easy players, because they have a lot of deficits. Otherwise, they would be maybe situated in Switzerland or in Norway. But from my point of view, they are the intermediaries between state and society. And we should not only talk about how to, when talking about civil society, about the NGO sector. We need also to tackle more seriously and more intensively the very awkward question of political parties. And of course, yes, please let me mention, I mean, we as political foundation, we have our partner parties, which are of course not perfect, far from that. And it's also for us not easy to work with them, but I think it is necessary in order really to have this kind of sustainable development. And it was mentioning Egypt. It is not a coincidence that, for example, Konrad Adenauer Stiftung had to close their office in Egypt because it was a bit, not controllable maybe from the government point of view what's going on there. So thank you very much.
Thank you. And I think that relates to one of the themes we heard earlier on participation and wide participation, not just the usual suspects, a variety of different stakeholders and a variety of different accountability mechanisms in these contexts. I'm afraid we have to close our discussion because I promised that we would end at 4. I'd like to hand the floor back to our host, Mr. Steyer, for any final remarks that he has, and then we'll close.
Well, thank you, and thank you, everybody for, I think it was a very fruitful discussion. I would like to very shortly touch upon a local experience and then to conclude with, I hope, some conclusion that could be also of a more global character. And that is, look at the country I'm coming from. And you mentioned already the experience from the Balkans. Who would say that Croatia, that was torn apart actually by war in the 90s, would be today a member of the European Union? And if you ask me, and I was involved in the accession negotiations, it was not the pre-accession funds, it was not many other issues that probably could be financially measured, but it was actually the EU's policies about how to reform judiciary, how to build democratic and inclusive institutions that allowed Croatia really to transform itself. Not saying we are the most successful, because we are not. We are having problems. Europe is having problems. But I think that we need to be a little bit more aware of that success, of the success of Europe itself, of the European project, and with being a little bit more self-confident, also go into this new transformative agenda also in that we are trying to seek with the SDGs. For me, universality is not against differentiation, certainly not. Universality is not against respecting cultural diversity, certainly not. I see that universality is incompatible, though, with the theories of exceptionalism. Who would say that Croatia would be? Probably in the past would say, oh, those are in the Balkans. It's impossible. But the same would have been said probably for some other countries in the south of Europe or some others, etc., for those who would say, no, this is, the institutions we have are only for our country because we are exceptional. I think that we need to reaffirm that belief, which is a little bit philosophical, that really the dignity of all people lies in that we are equal and that we all have the right to justice and to sustainable development. Thank you very much.
And with that, we close the session and thank all panelists and our hosts. Thank you.